According to plastic surgery, there are a lot of basic techniques which are related to the sutures he uses. And when we want to speak about sutures, we should remember the threads of lifting, the threads we use to make lifting. The composition of those threads is nearly the same like the sutures we use for incision, excision. So the difference between plastic surgeon and other surgeons is the way he uses the sutures and the other instruments. So according to suture, the purpose of suture is to maintain a position of tissue while they heal. The issue in choosing a suture are where in the body the suture is being used, how long the suture is intended to last, and the tensile strength of the suture, that is, the amount of force a knotted suture can withstand before breaking. According now to the suture permanence, as absorbable suture is made either of natural material that undergoes enzymatic digestion or synthetic material that is hydrolyzed by water. The rate of absorption varies with the type of material used. Fever and a moist environment will increase rate of absorption. Absorbable sutures are useful when suture removal may be difficult. For instance, in children or an unreliable patient. Absorbable suture is also used in environment with high crystalloid concentrations that may precipitate stones like the urinary or biliary tract. According to permanent suture is made from various plastics. It becomes encapsulated in fibrous scar tissue over time, making it inert. This is useful in slow healing tissue such as fascia and tendons. Patients with a history of scar hypertrophy or keloid formation benefits from the use of non-absorbable suture that is removed early. According now to monofilament versus braided. Some of the sutures may be monofilament and the other ones might be braided. Monofilament sutures are single strands that encounter less resistance as they pass through tissue and incite relatively little inflammation. However, they have less tensile strength than a braided suture of the same caliber and break more easily if crushed or crimped. Braided or polyfilament sutures are woven strands that provide greater tensile strength, flexibility, and pliability. Their downside, their downside is a greater inflammatory reaction and an increased potential for bacterial seeding, as the width of a polyfilament suture can be thought of a nest for bacteria. According to the caliber of the sutures, the caliber of suture is described with a measurement system that is stated in 0 S. For example, 50 is 00000. The number of OS is determined by how many suture diameters are added to make 1 millimeter. So, 02 has twice the diameter of a 40 suture. Generally, surgeon uses the smallest caliber suture capable of maintaining tissue apposition. Some sutures is coated to decrease drag their tissue and the coating. Although it increases caliber, is not considered while naming its caliber. According to the needles, so the suture in general is composed of the thread itself and the needle. Even the threads we are using for lifting, the same principle with some differences, and of course the technique is different. Needles, sutures come with or without a needle. Sutures without needles are called ties. Needles have three components: the eye, the body, and the point. The eye of the needle is the way the needle is attached to the suture. The closed eye is similar to a household sewing needle. The swagged eye joins the suture and needle in continuing and is the most common and convenient since it is preloaded. Pop-off sutures are a type of swagged suture in concentrate on concerted effort. The body of the needle is the portion grasped by the needle driver. The configuration of the body ranges from straight to U-shape. The point of the needle can be either cutting or tapered. Cutting needles have two opposing cutting edges and are used to penetrate tough tissue such as skin or fibrous scar tissue. A tapered needle has a smooth barrel that tapers to a sharp point to allow smooth passage of the needle through the tissue like fascia, vessels, and instruments. Later, we will speak about instruments.